In today's Health Watch, federal officials are warning that a drop in vaccinations in the U.S. may have led to an increase in pediatric flu deaths. The CDC reported nearly 200 children died in the 2023-2024 season. Wow, that is unbelievable. Officials say most children who died were eligible for a vaccine but did not receive one. Dr. Celine Gounder is a CBS News medical contributor and editor-at-large for public health at KFF. Good morning, Dr. Gounder. What do you think led to this drop in vaccinations?
Well, I think unfortunately, coming out of the COVID pandemic, we have seen a rise in vaccine skepticism, people less willing to get vaccinated. And as we've seen with the pediatric flu vaccines, that has led to increased hospitalizations as well as, unfortunately, some deaths.
What's the best time to get it, the optimal time to get it heading into the season?
So flu season typically starts in December and peaks in February. So sometime, say, before Thanksgiving, say mid-November, you want to get your flu shot, your COVID shot. But that said, whenever you can get it done, you should get it done, even if it's a bit earlier than that.
Who's at risk for flu complications?
Well, as we saw, pediatric populations, so in particular kids under the age of 5 are at risk. The older adults are at risk. Pregnant women, which is a group that's often forgotten about, are at risk. And then folks who have underlying medical conditions, heart, lung, diabetes, people who are immunocompromised.
And so the FDA approved a new kind of innovation in flu vaccine administration. Can you tell us about that?
So we've had the flu mist for a long time. It is not as effective as the shots that you can get. Even the shots historically have ranged from 20 to 60% effective, depending on how good the match is. That's still pretty good. If I told you a dress was 20% off, you would still think that was a good deal.
I'd say buy it.
Right? Yeah, It's still a good deal. But, I think we've gotten used to higher levels of effectiveness, especially with the COVID vaccines actually having been so good. The flu mist is maybe around 25% effective in preventing severe disease. But for people who are really just can't be bothered to go in and get a flu shot, who really hate needles, it does give you an option to at least reduce your risk a little.
The can't be bothered, don't like needles crowd, pretty big. It's a lot of people.
It is a lot of people.
Yeah. All right, Dr. Celine Gounder, thank you so much.